But consider this. Let's say I own a huge tract of land about halfway between Casper and Shoshone. Anybody familiar with that area? Okay. I value my privacy, and I put up barbed wire fence with no trespassing signs every 100 yards surrounding my property. Let's say you're flying a small airplane from Casper on a trip to Cody. You encounter engine trouble and crash land on my property. Through no fault of your own, you're trespassing on my property. Since you're on my property, do I now own you? I don't want anyone there, but you fell out of the sky onto my property. You have internal injuries from the crash, and you need urgent medical attention to survive. You're close enough to my house that I know the crash happened. Nobody else does yet. The nearest medical facility is at least an hour away, meaning at least 2 hours before you get help if I call someone else. The only way for you to survive is for me to get you safely through my property and off of it to the proper facility. What should I do? Your crash put a serious alteration in my plans for the day. Rescuing you would put my vehicle at risk for serious damage going off-road, and especially if you know that geography, I'm telling you the truth. Serious damage going off-road to help get you off my property, as well as mess up my career plans, since I was on the phone in the middle of a serious negotiation for a lucrative job when this crash happened. What's the right thing to do? The safe thing for me to do is to just let you die. I get the job, nobody gets blamed for you dying. So is the argument that when an unforeseen event happens on my property, that I can deal with it however I choose, no matter what the consequences are, is that a good argument? One of the legitimate functions of government is to protect the innocent and helpless against violent aggression. This was articulated in the Declaration of Independence as an individual's right to life, liberty, and the pursuit of happiness. Our job here today is to recognize the individual. And our job as a state is to recognize and protect the rights of the individual, especially those most vulnerable.
Thank you, Madam Chairman. Did I hear correctly that you're a board-certified obstetrician?
That's absolutely correct.
So I believe you testified that at 9 weeks you could hear the heartbeat outside the womb. So at 6
correct.
weeks, would you have to use, or earlier, would you use a vaginal ultrasound to detect the heartbeat?
Not necessarily vaginal ultrasound, okay? Can be transabdominal ultrasound on occasion, can be heard from the outside. Can be seen from the outside, rather, and identified. That's correct.
Madam Chairman.
Yes, ma'am.
But it is your testimony that that's not certain, is that correct?
That's not certain, that's correct.
I have one more follow-up question. As a board-certified obstetrician, if you had a patient who was diagnosed with cancer,
Yes.
would you recommend that they continue a pregnancy and delay cancer treatment?
Yeah.
There are several cases and several instances of non-lethal cancer treatment. It's been very successful, particularly with breast cancer and other cancers as well. It is my opinion that the vast majority of cancer treatment can be delayed without significant consequence.
Any further questions?